Jaws from Molina, and he is going to share with us the systems, providers, websites, and upgrades that we can expect for 2022 open enrollment. Before Dennis begins, I just wanted to let our agents know that we plan to be rolling out our new agent portal this week. And for all O'Neill Marketing agents that have completed their electronic onboarding with us, you will be able to access this portal. Those that have not completed their electronic onboarding, we encourage you to do so that you can get onto the portal, which will allow you to view your current and pending appointments, provide a chat feature, view carrier details, and update. It will allow you to update your agent information. Eventually, as we continue improving this portal, it will allow you to view your commission schedules for each carrier and will allow us to push leads out to our agents. So we're excited to roll that out this week, and please look for notices about that. We'll definitely need your help in identifying bugs and providing feedback as we work to make this a better portal for your use. Also, I wanted to let you know that we will be recording this webinar, and Dennis will allow us to distribute the presentation in PDF format. So all of this will become available for you. We appreciate that very much, Dennis. As you have questions, please type them into the Q&A, and following his presentation, Dennis will go through those for everybody. So without further ado, I will hand it over to you. Thanks.
Thank you very much, Louise. Once again, my name is Dennis Pujols. I am the Marketplace Sales Manager for Molina Healthcare. I actually run the state of Florida and Mississippi, but we're going to go through, basically this will be a national presentation. I will go through all of our states fairly quickly, honestly, because I don't have I can't give you all the inside information, in getting into the weeds with all the other states, but I will be able to give you my counterparts' contact information. So if you have any questions, you could either email myself or to my counterparts, and we'll be able to assist you any which way possible. But once again, my name is Dennis Pujols. I am the Marketplace Sales Manager for Molina Healthcare. The easiest way to contact me will be through email, which is Dennis with one N, so DENIS.Pujols, PUJALS @molinahealthcare.com. You can contact me via cell phone. That is my office, my cell phone, my everything. So you can text me, and as long as I'm not speaking to another agent or agency, I will answer. So if not, please leave a message, and I will return your phone call as soon as possible, and you'll hear that same recording. Anyway, let's go ahead and get started. So just a little history on Molina Healthcare. So we were founded by Dr. C. David Molina. Basically, he was an emergency room physician in Long Beach, California in the 70s and 80s. So he noticed that the majority of his patients were members that didn't have quality health care. They really couldn't afford to go to the doctor, so they just go to the emergency room when something happened. Well, in 1980, he went ahead and opened a community clinic where he thought caring for people was more important than their ability to pay. So today, his legacy lives on through Molina Healthcare. We are now in 15 different states. We have over 3.5 million members in those 15 states. It's actually a little higher than that now. We're serving people, our members, through Medicaid, Medicare, and of course, Marketplace. So we're staying true to his convictions, which were basically treat each person like they're a member of the family. So as I mentioned, we were founded in 1980. Our total membership as of May 18th is 4.381 million members nationwide. So we're ranked 155 on the Fortune 500 with revenues over $19 billion. We've grown through acquisitions, through expansion. So we are actually still growing at this moment. You'll see some expansion information that I'll be providing in a couple minutes. But our mission basically has always been to provide quality healthcare to those people receiving government assistance, to those people in need. In all reality, do we focus? Are we the best choice for everyone? No. That's why but we do give quality service for those that actually do need those the healthcare services, and mainly those that are in need. So our vision basically is to distinguish ourselves as the low-cost and most effective and reliable health plan, delivering government-sponsored basic care. So let's go ahead. So open enrollment is going to be beginning, of course, November 1st, 2021. And as of a couple weeks ago, they finally made it official, and they extended it all the way to January 15th of 2022. So it is not just a 45-day sprint. There's an extra 30 days in there all the way to January 15th this year. So OEP was extended by CMS on September 17th. So like I said, a couple weeks ago. Covered California announced that they're going to be going all the way to January 31st of 2022, even though they basically didn't close last year at all due to COVID and the special enrollment. But and just like FFM states went through the special enrollment all the way to about a month and a half ago, California decided they'll go ahead all the way to January 31st, and of course Wabi and New Mexico, Kentucky, they're all going all the way to January 15th as well. They already announced that as well. So here's our footprint. So we were in 11 states last year. We expanded to 14 states this year. So we had 3 new states coming on to our footprint. Those 3 states are Idaho, Kentucky, and Illinois. In addition to, of course, our 11 states that we had, which are California, Florida, now Idaho and Illinois and Kentucky. We have Michigan, Mississippi, New Mexico, Ohio, South Carolina, Texas, Utah, Washington, and Wisconsin. So we did do some expansion, not in only those 3 states, but we are expanding into other counties as well in our current footprint. So California, there's no expansion. In Florida, there's no expansion either. Like I said, in Idaho, we're going into 7 counties in the state, and I'll show you the footprint in a second. Illinois, we're going into 4 counties surrounding the Chicago, Illinois area. Basically, 75% of the enrollments in Illinois are in Cook County, and then the other 3 counties surrounding Cook County is where we're going to be entering. The rest of the state's very rural, so we'll look at that in a second as well. Kentucky, we're going in 3 counties surrounding the Louisville area. Michigan, we've got 7 new counties surrounding the Grand Rapids area. Mississippi, there's going to be no expansion, or New Mexico, just because we're already in every county. We are already statewide in the states already, so there can't be any expansion. Ohio, we're increasing 24 counties. South Carolina, 10 counties. Texas and Utah will remain the same. Washington, we're expanding 4 counties, and Wisconsin, we're going to be remaining the same as well. So 59 new counties to our current footprint for a total of 343 counties nationwide. So looking at the footprint, so Florida, we're going to be remaining with our 12 counties that we had. We were looking at expanding a little bit. We did expand on the Medicare side, and we did expand again through acquisition of Magellan on the Medicaid side. So there will be some expansion. We did look into it, but it didn't make sense for us to do it at this moment. So like I said, we're going to remain in the 12 counties in Florida. So of course we have Miami-Dade, Broward, and Palm Beach. On the West Coast or central or on the I-4 corridor, you have Pinellas, Pasco, Hillsborough, Polk, Osceola, Orange, and Seminole counties. And then up in the Jacksonville area, we have Clay and Duval counties. So like I said, remaining the same. My other state, Mississippi, there will be no expansion because we are in all 82 counties at this moment. So no expansion there. South Carolina, we're practically going to be in the whole state. The only 3 counties we're not going to be in, is probably easier to mention those 3 counties, which is Oconee, Anderson, and Pickens. We are in the rest of the state. So we did go into, I believe it was 10 new counties. Yes, 10 new counties. So we got the majority of the state. That's a great area to look into as well. Ohio, large increase. So we're increasing 24 counties throughout the state, pretty much where we're not in our extreme rural foresty areas. So not much population, but the majority of the state. So a lot of opportunity up there. Michigan, 7 counties surrounding the Grand Rapids area. So a lot of expansion up there. It's mainly the Detroit area down here in the southeast. And then on the west side, you have the Grand Rapids area. Wisconsin, we pretty much have everything on the eastern side of the state. The rest of the state, like I said, is either farmland, marshland, not much population. So we do have the population centers from Green Bay down to Milwaukee. A lot of opportunity there. Kentucky is one of our expansion states. So this is the Louisville area. We're starting here. We should be expanding in the near future again, but going to start into this area. So just so you know, it is a state base. They started off as a state base, then went FFM, and then this year they returned to state base. It's KY Connect or a KY Nect. If you're a returning agent there, they're just closing off the certifications now. But for new agents, you can go ahead and get certified into their state certification. So that is opening. That is open at this moment. Illinois is an FFM state, mainly, like as I mentioned, we're in Cook County, which is the Chicago area, but we're going into Kane, DuPage, and Will counties as well. That right there, it covers about 85% of the total enrollments for the whole state. So once again, great area to look into. Texas was our largest enrollment state last year. So we did extremely well in Texas. There's no expansion this year, but anywhere from El Paso, you got Dallas, Fort Worth area up here. You got Houston area down on the southeast side, or actually east side. San Antonio, we went into last year in expansion, did extremely well down there. Of course, Star, Webb, and then the south side of Texas. For the most part, we were #1 price across the board. We have an extremely robust provider network there, so great area to look into for enrollments. California, there will be no expansion this year. This is our backyard. We're out of Long Beach, California. That's our corporate there. We've always done extremely well in Southern California. No expansion there this year, though. Utah, once again, did amazing up in the Salt Lake area. We were very well priced, got a great provider network there as well. We did extremely well. We pretty much did it. We did well in all of our states last year. We hit our goal in every one of our areas. So that is no matter what, it's a great thing, and we were able to expand in a lot of areas because of that. But it still should be great opportunity. New Mexico, once again, we are in the whole state. They did just go state-based this year, so I'm not sure of all the intricacies of their state-based certification. But of course, New Mexico is a very deserty area, but we did extremely well in the populated area. So if you need any assistance, let me know. I'll get you over to my counterpart, to our counterparts over there, other marketplace sales managers, to Gene. All right, so Washington, we are expanding 4 counties. Once again, state-based under Wabi. It's a lot of opportunity there as well. Idaho, one of our new entrants, so up in the Idaho Falls area, we're there. So basically, this is a good area. We once again went to the populated areas. It's one of our top Medicare states. So if you're looking to grow over there, it's a great area as well. They are state-based as well. Now, there are some going into the actual plans for this year. There are going to be some changes going forward. So one of the largest changes, and mainly came in effect after the ARP, which is still available to our members, the new subsidies that are available to all the members. We are going to be eliminating our bronze plans in the majority of our FFM states. So what does that mean? We're not going to be eliminating the bronze plans in 4 of our states, which are Florida, Mississippi, California, and Washington. So California and Washington is required by their states to have a bronze plan. Florida and Mississippi were the only 2 states that actually were profitable, and that's because of the utilization, the way it worked out. Now the other states, it didn't make sense, especially after the new ARP coming out and the new subsidies, where pretty much the majority, 95% of the membership was switched over to the silver plans anyway. So they're going to go ahead and for Michigan, Ohio, South Carolina, Utah, Wisconsin, and well, Texas is a different also, but we're going to be eliminating all of the bronze plans. So what does that mean? Now, there is a way to, we are adding some plans now to combat that price wise, and then those members, if they were to passively renew or renew into the same plan, we have them mapped to the closest plan that they can get, especially with subsidies and pricing in mind. So all the bronze plans will be mapped into either the silver 1 or the silver 2 plans. Okay, so you'll be able to, or those members won't lose coverage. They'll be mapped into those new plans. Now, the silver plans, we are adding to combat the loss of the bronze plans. We are adding a silver 7 plan. Now, that is going to be a much more competitively priced silver plan compared to our renewing plans that we had. So, and then the gold plans are going to be remaining the same in all of our states. So, speaking about for Florida and Mississippi, so our 2 plans that were utilized the most were our Bronze 1 and our Bronze 4 plan. Our Bronze 1 is our regular bronze plan that we've had since day 1, and our Bronze 4 is that zero deductible copay plan that we put forward last year. So all those plans, they will be renewed just as normal. The Core Care Bronze 5 plan, which was our other zero deductible plan, which is a little higher on copays, will be mapped into the Bronze 4 plan. So if they wanted a vision plan, we're going to be eliminating the vision plans on the bronze plan, so they will be mapped into the silver plan. So you can go ahead and see this. So our silver plans, once again, are going to be renewed. We are adding that new silver 7 plan into our portfolio. But for Florida only, we're going to come out with a new plan just for South Florida. So South Florida is going to have basically, I wouldn't call it a discount plan, but it's a tiered network plan. So meaning the only thing we're really looking at is the hospital network that they're a part of. So in Miami-Dade and Broward, the Silver 5 plan will be available. The providers will be the same. The only the differences will be subtle differences on copays or the amounts that the member would have to pay. But the biggest difference will be the hospital network. So for Miami-Dade, the hospitals on the Silver 5 plan will be the Jackson hospitals. So Jackson Memorial Hospital, you have North, South, and Central. And then in Broward County, it's the Memorial Hospitals. So the reason why we're able to do this is because we had better contracts with those hospitals, and we're able to reduce the cost associated. So it'll be a much more competitive priced silver plan. It's also there to compete with the Super Saver plans from the other carriers. I know everybody pretty much has one now. So this plan will compete with that. And then not only that, with the elimination of certain hospital networks off of our provider network, and biggest one, of course, is Baptist. And if you have any questions of that, I'll go ahead and answer that at the end. But we did eliminate Baptist from our network, which freed up our ability to lower the pricing on the silver plans to make us much more competitive than we were in the past years. So we do have our gold plans, which will be renewed as well. Now, looking at the other states, Texas they have some certain nuances. So we will once again be eliminating the bronze plan, so they will be mapped in. They do have an additional plan, the Constant Care Silver 3 plan over there, and of course the Silver 7 plan, which is that more competitive plan. And then we did add a Confident Care Gold 3 plan as well. Actually, we had it last year. We announced it last year, and we're renewing that plan as well. New Mexico, once again, eliminating all of the bronze plans, going into the. We do have the added new silver plans as well, and then we're mapping the gold plans as well. So just going through these really quick. I know there's a lot of states, so. The renewal plan. So in Washington, we will be renewing our bronze 1, our silver 1, and our gold 1. So of course they mandate that you have at least one plan. So we do. These are the plans for Washington State. So for our new enrollees, our new states, so they're going to be going in without bronze plans. So it'll be mainly silver and gold plans. So KY, which is, and one thing, the reason we entered into Kentucky is actually we purchased a health plan by the name of Passport Health. So it's very well known. It's a very well known plan in Kentucky. So we're going to be maintaining the name. It's basically Passport Health Plan by Molina Healthcare. I know that's the only state that we do that with. Usually we just transfer it over to Molina. It might transfer over in the future, but since the name notoriety in the state, everybody knows Passport Health there, so we're going to keep Passport Health Plan by Molina Healthcare. So once again, the silver plans as well as the new silver 7, as well as the gold plans are going in. That'll be for Idaho, which is your health Idaho. You got, even though Illinois is not a state basis FFM, they have their own title for their state. So get covered Illinois. And of course, you have Kentucky. So these are the quick little view of a breakdown of copays and deductibles and max out of pockets for certain plans that we have. And I'll go through all the states. Like I said, it's a lot of information. If you'd like, just take a quick snapshot and you'll be able to see this. I will be sending over this presentation over to Louise and to everybody at O'Neill Marketing, so you will be able to access this. Plus, you can always go to MyMolinaMarketplace.com and you can get all the information for all of our plans through the MyMolinaMarketplace.com website. So, but you'll notice subtle differences. Of course, the silver plans are always based off of their income levels and what category they fall into. So there's 4 categories. You have the 100 plan, the 150, the 200, and the 250s. So the 250s are those that usually don't receive subsidy. And then the one, depending on what level of income they receive on the federal poverty level, will put them into a certain category. So like I said, 100, 150, the 200, or the 250 levels on the silver plans. So here we go. Next plan, this is a tiered benefit one. So this was showing you the Constant Care Silver 5 for Miami-Dade and Broward County. So just a quick snapshot. It's a choice hospital plan, as I mentioned. So if they use outside of those choice hospitals, it will have a different copay for those hospitals. Okay. So moving on to Mississippi, once again, it's pretty much the same breakdown. The majority of our plans have not changed. It's just that we added the Silver 7 to all of our plans, and usually they are pretty much exactly the same across the board in all of our states. Certain states will have subtle differences, but for the most part, they're pretty much the same. They're mapped all the same. So South Carolina, if you look at it, same thing. Now, one thing I got to mention about Mississippi and South Carolina, those 2 states, usually the carriers upcharge for smokers. We actually don't. So it's the same pricing for smoking or non-smoking. So you might want to take that into consideration. That does help with enrollments when you're between 2 different carriers. Ohio, here you go. Once again, we don't have the bronze plan, so you'll be able to see the silver 1, the silver 7s, and the confident gold. Those are the main plans we're going to be offering this year. Same thing with Michigan. There's pretty much no change. Wisconsin, exactly the same. Going through Kentucky, I know I'm going quick, but like I said, all this information will be available to you. Plus, like I said, you can actually go to Molina Healthcare or MolinaMarketplace.com and get the member information or the policy information. So Illinois, going into Illinois with the same plans. Texas, pretty much the same stuff. I mean, all the FFM states are pretty much the same. There's subtle differences. Some states require certain differences or add different plans as well. So covered California, once again, state-based. These are the different plans. They basically will make sure all the plans are pretty much the same across the board with all carriers. Biggest difference will be the commissions paid out and the provider directory, pretty much. So Washington State, the breakdown of their plans there. Once again, more of Washington State. Utah. New Mexico, which is now state-based. And by the way, if you need any additional information, if you need to get into the weeds in any other of these other states, I will give you at the very end of the presentation. I'll put up the contact information for all of my counterparts across the United States. Idaho, one of our new entrances this year. All right, so one new thing we're going to be coming up with this year, and we've been hearing it from our members and our agents throughout the last couple of years, is a new wellness program or an incentive to our members. I know other carriers use it. It might not be the exact amount that they're putting out there, but the biggest reason that most carriers use this is to gather that the HRA or the health risk assessment of our members. So this is going to assist us basically in one, helping the members, giving them information that they may need. Plus it allows us to gather the health or evaluate the health of our members so we can better support them. So there will be a $50 incentive reward, whatever you want to call it, for the completion of our HRA, which is our health risk assessment, and our wellness exam. Basically, this is, I know it's not to the level of everybody else, but it's a start and it's a great little incentive. We never had an incentive prior to this. Now we're finally launching our volunteer participatory wellness solution, and it's going to be available in all 14 of our states. So they have to be 18 years or older to be able to participate in it. It's completely voluntarily. If they don't want to do it, they don't have to. But basically, they'll have access to a suite of wellness programs. Basically, get information on interactive programs to help manage their asthma, their heart disease, depression, diabetes, high blood pressure, cholesterol, and they gain them access to educational programs as well. So it's a $50 one-time $50 incentive that they can get it either in a physical check, I believe is what it is, or a discount gift card. So, or either a physical gift card as well. So it's a good thing to have going forward to incentivize our members to actually provide or volunteer for this health perks. So another thing that we're going to be, and you're going to see a lot of upgrades this year. We've been trying to upgrade a lot of our systems. So some of it has had some heartaches during the upgrades, but we're currently we're past those heartaches right now, and it's all moving for the better going forward. One of the things also is on our ID cards. So not only do we add the perks, but our ID cards, we're making them a little easier to use or user-friendly, easier to read. So there's a lot of information now you got to put on there, but we want to make sure we don't put in frivolous information. So and then we're trying to clean it up and makes it easier to see. So basically the expanded display, it has certain requirements that you have to put on, but it's going to be it's a cleaner layout, and it's going to be easier, like I said, easier to read. So we're adding the deductibles to the card this year. Once again, we will not have the doctor's name or information on the physical card. Of course, they can access their cards digitally through either Mymolina or their health in hand application on their phone. Now on those digital platforms, then it will add the PCP's name, but of course they can change that information. They can change a PCP pretty much once a month if they would like to do that. So they could just print that out at any time. But it's a little easier to use. They have more information on there. It'll have the deductibles on there, so there's no confusion. Plus, it'll have the contact information for our nurse lines and other CVS on that card as well. So another upgrade that we just went through is our new provider online directory. The one that we had in the past was not the easiest to use. It was more set up for a Medicare or Medicaid application. So a feedback we've gotten over the years is that it wasn't completely accurate. It was hard to use. So we went ahead and switched over to another provider on that. So we went with Sapphire. They are the same provider that handles United Healthcare. I believe Anthem uses them. A couple other of the larger carriers nationwide go ahead and use it. So it went into effect about a month and a half ago. and it is great to use. So it's extremely accurate. You can actually, as a member, you can log in with your same credentials as their member portal, and they can customize it for their own needs. So you can customize the language, you can customize it with their doctor, you can look for other doctors in the area. So there's a lot of little things that you can do with this. So it's available now you can just go to molinamarketplace.com, click on find a doctor, and it'll go ahead and take you to the provider directory. So once again, much easier to use. You just click on what you're looking for. You can see if they're accepting new, you can click on certain boxes to see if they're accepting new patients, if they're primary care, distance in between, look at all the hospitals. The only thing I do have to say is make sure that on the top right, you got the correct zip code, which will take you to the right state. It will default over to California. So once a member logs in, they can actually set it to their area. But if you don't log in, just make sure you're in the correct state, because if you're under California and you put something in Florida, it'll show as no providers in that area. So make sure that you're actually in the correct state. Okay. Once again, much more accurate, so much easier to use. It's it's pretty nice to see this new provider online directory. Okay. So moving forward, we also have we've had this for the last few years, but we've done some upgrades to it. This is our Health in Hand application, or Molina Health application. It's available for Androids and Apples and pretty much any smartphone that you have. You can log in. It'll have all the members' information. It'll have a provider directory. It's basically like going into Mymolina Portal. It's the Molina mobile application. It'll have all the doctor information. You can have the ID card on their phone, so there's no need to print one out. Basically, if you need any assistance, to speak to a nurse, or any online doctor visits, you can actually do through the Health in Hand. You could also look up your provider, your doctor information, everything on the Health in Hand or the mobile application. Okay. One of the upgrades that we did, which caused a little headache, and I'm sure all of you went through it, was the upgrade to our new billing system. So we knew our system was not equipped to handle the growth that we've had over the years. So a few years ago, they decided to go ahead and change our billing system. So what did they do? 2 years ago, they went ahead and decided to do this upgrade in May. Why did they choose May? Because usually May is the month with the least transactions. The members are already effectuated. The commissions are taken care of. Usually, like I said, the least transaction historically during open enrollment since 2013 was always May. Well, then of course ARP came around and we ended up having a record number of transactions. So no excuse, we should have taken care of it. But like I said, we didn't anticipate the change and the number of transactions going on. Pretty much everybody was able to upgrade the number or increase the subsidy that was available to them. So a lot of change orders came in, and this came at the same time we were changing from our old antiquated system to our new system, which is WePro. And once again, apologize for any issues you may have come through that did put a lot of strain on our member services. It put a lot of strain on our broker support. But the good thing is 95% of all of those issues have been taken care of. We have increased our member services by, well, I'll get into that in a second, but we've increased it over a couple hundred new member services members, and we've increased our broker support, so we don't have those issues at this moment. So we're doing pretty solid. Good thing is now we have the new PaySafe in place, a new WePro system. So excuse me. So basically, they're going to handle all of our enrollments and our payments going forward. So anytime you go to our billing pages or enrollment, they're all tied in. Any enrollment platform that we're connected to will go through WePro now going forward. So you can pay through checking account, debit card, credit card payments will all be done through here. You can make one-time payments. You can set up auto payment through the WePro site. Basically, the member is brought to the payment confirmation page, and you just select Molina there, and you can make the payments there. So once again, much easier to use. It's going to be the one big difference. Auto pay did change the date. On our old system, those funds were removed from the account on the 22nd. Now it'll be done on the 31st, 30th or 31st, the last day of the month. If that day falls on a holiday, then of course it'll be pushed to the next day or 2 days later if the holiday is extended. So, so going forward, like I said, it's been a little bit of a headache making that transition, but now that we made it, thank God, it's pretty smooth and it's so much easier to use. And that's one of the good upgrades that we've gone through in the past couple of years. So how do you make the payments? There's a couple ways. You can either go to web payments at billmatrix.com or simply go to molinapayment.com. So if you go to molinapayment.com, you're going to have to, well, it could be set up for, they can register for auto pay through there. But if you're going to make a one-time payment, you're going to need the last four of the social security number, or you'll actually be able to use the subscriber ID as well. Primary date of birth, the zip code, and email address. You click continue. It'll validate or verify the policy. And then once you're in, you can go ahead and make a payment. So you can pay by bill pay. You can pay by mail. The members can pay by MoneyGram or even pay by phone if you call them member services. They'll be able to assist as well. Another upgrade that we did is on the Mymolina Portal, the member portal, basically. So we did make it a newer, sleeker design. It increases the ease. It's a lot easier to use. It's more user friendly. Some other things that you can sign up for. The member will be able, once they're registered and logged in, they'll be able to sign up for bill pay or auto pay there. They'll be able to make payments. They'll be able to see their payment history as well. You can make changes to your plan, meaning if you want to change your PCP or anything there. So you can see your coverage. You can click on ID card. If you want to print an ID card, go ahead. If you want to change your doctor or get doctor information, or even set up reminders or anything like that. So basically a lot more information on the mymolina.com page for the members. So like I said, that one is going to start being available to the members as of October. So by next week, it'll be up and running for everybody. That's one of the new added upgrades. So last year we did launch our MolinaMarketplace.com. Now this is a separate website strictly for our marketplace members. Of course, you can still go to MolinaHealthcare.com and gather the information there, but it's being redirected over to this page now for all of our marketplace members. The old website, not as user-friendly. It's more set up for Medicare and Medicaid information, but now with this one, once again, easier to use. I mentioned earlier that if you want to access any of the plans or the policies, see what all the policies entail, there's a member handbook there where you can go ahead and click on that member handbook. Or even the other states, you can get the Covered California calculator, the state-based. This is available for all of our marketplace states. So, and you can go ahead and see what the plan was in 2021, if there's any changes between 2021 and 2022. So all of our plans are basically posted there. All of our frequently asked questions are there. Everything's updated. Once again, much easier to use. So if you look at the page, you'll be able to see for individual and families, that's the member information. If you want any information on plans, any member for information, if they want to log into my Mymolina page or find a doctor or anything there, it's under the members. The providers, they can log in here as well. For brokers, you can click over here or hover over it, and you can have access or log into your broker portal, which we'll discuss that in a second, and some other information. They could remember if they want to go in alone, they can enroll themselves, but I wouldn't recommend that. You guys are all brokers, so you want to make sure you take care of them yourself. But just enter the zip code and view the plans, and it'll show you all the plans that are available to your members, and all the plan information will be there as well. So this here is our member services. Please remember that this is mainly for members. So if you were to call to try to assist your member, the member services are not, due to HIPAA compliance, they're not allowed to give you that information. So you have to have authorization from the member. Now, every state, like as I mentioned, we did add a couple hundred new member services to alleviate the stress that we're putting, because due to all the billing changes and the upgrades in the systems. So WePro went ahead and added a few hundred themselves. We added, they're going to be handling our enrollments and billing. We still have our member services to handle all other information for the members. And of course, we do have our broker support team for our brokers as well. But every state has their phone number. Please take a snapshot of this, and you will have the contact information that you can give to your members for any member services. All right, talking about marketing now. So we are increasing our marketing budget for all of our states. So what it is, and it's going to go in different stages. So stage one is going to be warming up. So we're going to introduce, basically the majority of our marketing goes through social media. There will be some print, there will be some billboards, but the majority goes through either social media or streaming sites, such as Facebook, Pandora. So you'll be able to see that. Basically, we're going to start warming up in the middle of October. And basically, it's to create a little anticipation and awareness, to drive awareness to Molina, to our products, and to show the differences of why choosing Molina. Now, once November 1st starts, now open enrollment starts, we're going to promote the promote enrollments to Molina. You're going to put a lot of emphasis on the options, the value added benefits, and the differentiators between us and other carriers as well. That's basically to drive awareness to the product line. Then they're creating some urgency. Of course, this is showing the middle of December to the end of December. Now that we extended open enrollment, this will be changed to the beginning of January, to the middle of January, to the end of open enrollment. So it'll create an urgency to finalize their enrollments. And then, of course, at the very end, after the 15th of January, they're going to still promote the other states that were California, Washington, that extended it all the way to the 30th. And of course, special enrollment, because it doesn't end there. But that's the approach. Of course, we did come out with our Lean on Molina marketing campaign last year. It went extremely well. These are some ideas of what they're going to look like this year going forward. So it's just evolved. The campaign is just evolving, getting a little better. They're maximizing all the synergy of all the products, meaning it's not just our products, since we pretty much, Molina is the same for Medicaid, Medicare, and Marketplace. And Marketplace does not have the restrictions as the other two lines of business do, or the state restrictions. So they're able to get the name brand out there a little more. So it's definitely going to help out getting as much marketing as possible for all of our lines. But this should help out the agents as well, because it brings notoriety out there, gets the name out there, and then of course with that information, the members will be asking. So we've been in the market since the beginning. So since 2013. Actually, 2014 is when we came into Florida, and I've been with the team with Molina since 2015. So I know we didn't do much marketing in the past, but now we're starting to ramp up the marketing throughout all of our states. So going on the renewal information. So one thing we do every year, especially this year, we're going to have to, CMS mandates that you provide information on renewal information to all of the members. So we're going to start sending out, I believe it's 45 days prior to open enrollment, to have to start sending out some information. So since this year we are eliminating some plans, we do have to notify those members about the elimination of those plans. Plus, we're going to make sure that you have all of your information as well of your members. So starting probably in the next couple of weeks, if you look in your agent portal, under not the book of business, but the future book of business, all of your members from your book of business should be uploaded to your future book of business, as long as you're the agent of record. So what does that mean? It's basically to help you have all the information of all your members, so that you're able to go out, reach out to them, and renew them, or set up a time prior to open enrollment, so that right when open enrollment hits, you're ready to go. And then you can focus on them. And then if you have new enrollees, it'll help you get to the new ones as well. And pretty much, especially the majority of them on this call are from Florida. I know if you're not touching or contacting your members, someone else will be. So make sure that you're on top of your members. Don't let them auto enroll or auto renew. Make sure you contact them to make sure all the information is correct. So one thing that's happened, and CMS does mandate also, is that they have to we have to send out what the cost, the anticipated cost is going to be. So we know what the cost of the plans are going to be, but we don't know the subsidies. So we have to go back and use the subsidies from the prior year. Now, that doesn't always make it as accurate as possible. So this is every carrier, it's not just us, but just so you're aware that that might come out, they might have some questions on that. So you might want to be able to alert them to upcoming changes. So one other thing, as I mentioned, also, since we are for the renewal, communication has to be sent out. And so we want to make sure that everybody understands what's happening in the states, especially that are going to be eliminating the bronze plans. So we want to make sure that they're not going to lose coverage. They're going to be mapped over to our renewal or our silver plans, or to the best plan, the closest plan to what they had in place. Of course, they could always enroll into any new plan, but it'll have all the information. Plus, it'll have the open enrollment period. There, basically all the information they're going to need for of what's happening with their policy for coming for the upcoming year. Now, if they don't choose anything, of course, they're going to be mapped, as I mentioned, into that other plan. They'll be renewed into the plan automatically. If it's an auto payment, they'll just continue with the payments. If it's a new plan and you don't actively enroll them, then of course they're going to be sent a bill, and that policy will not be effective until until that binder payment is made. Okay, so going into our broker portal. So now, how do you access it? The easiest way would be to either go to molinahealthcare.com or molinamarketplace.com. Hover over brokers, you'll see the link to them, the marketplace, to the view portal. So you can click on Molina Healthcare Medical Insurance Marketplace for brokers, and it'll take you to the view portal. It's the same sort of thing. It'll say broker portal on the molinamarketplace.com site. There is a couple videos to show the members or the agents how to access it, how to log in. But basically, all you're going to need is your username, which is your agent code. So it's going to be AA, BA, BB, whatever. That's going to be 2 letters and then 4 digits. You should all have if you're an active agent, every agent will have access to their own portal. So through the portal, you'll be able to, well, actually, if you haven't reset it at the initial time of that you're signing into your account, you can go ahead. It's going to ask you to set up a security question and to choose your password. Now, it does reset. If you haven't used it in 2 months, it will reset the password. You can try logging in, but if you don't have access, click on forget password, and it'll ask you the security questions that you entered at the initial time of registration. So you can reset it if you forgot it. So anyway, and there's, like I said, as I mentioned, you can actually have these 2 videos will actually help you walk through it. So once you're inside the portal, it's there's a lot of information. Of course, you have the broker support unit on the information at the top. So MP broker support. MP just stands for marketplace. Marketplace broker support phone number is 855-885-3179. You have option 1 for broker services, option 2 for broker care team, option 3 is the commissions team, and option 4 is a contracting team. Now, there's a lot of information that you can gather from this portal. Is it the most user friendly or easiest to use out of all the carriers out there? No, but it does give you a lot more information. And that being said, we are going to be adjusting and upgrading our portal in the next upcoming months. So soon, coming soon, will be the ability. It's not available yet, but the ability to print out ID cards for your member. You're going to be able to make a payment through the portal for the members as well. There's a few things that you're going to be able to assist the members on. It'll be a little easier to use or user friendly than this system. But as I said, I've become so accustomed to this one that honestly, you play around with it a little bit and it's pretty simple to use. But it'll give you a lot of information that you can use. So like I said, once you log in, the first thing you'll see is going to be book of business search. All you got to do is hit search and it'll show you your whole book of business. If you want to look for a specific name or person, go ahead and you can enter in any one of these fields. So once it pops up, you'll have all the information. If you want to print out, let's say, a spreadsheet, an Excel, CSV, in the top right hand, right above on the right, when all the information's showing, you can click on Excel or CSV, and you can download that information. But once you click search, your member information will be there. It'll show pretty much a lot of information. If you really want to get into it, click on the policy number and all the member information will show up. So you can have an idea. But what's really you're gonna be able to see is the effective date of the policy, the grace period. If they're in grace period, that means they're late on a payment and their policy is suspended at the time. It's not terminated, but due to non-payment, they're in a grace period 1 or 2. Once it hits 3 months, they are terminated. So just so you know, it'll show you the paid through dates. That can help you, one, for commission reasons, or two, just to make sure that the policy is active. Now on the left-hand side, you can see a lot of different icons. So you'll have agent icon. That'll tell you about your appointments if you're ready to sell. And basically, if you're in multiple states, it'll show all the states that you're appointed in. If you have the FFM certification or state-based certifications, if you're needing an E&O, any of that information, it'll tell you if you're ready to sell or not. So, and then going down the line, you can have areas for documents. So if you're asking for any reports or a document, you can request that. If you have any requests, so if you want to add another state or upload something, you can go ahead and request it here through this tab right here, I believe. There is also a tab for under this one here for reconciliation. So if there is a member missing from your book of business and you know they're active, or you want to see what's going on with them and why you have not received commissions or anything on that, you can go ahead and do what's called a reconciliation. You can download the form and email it directly to our commissions team, or you can go ahead and upload that member through the portal itself. Then what will happen is our commission team will research that policy and basically give you the feedback on it. So if it's under a different agent of record, or if they have not paid, or whatever is going on with that member, they'll give you the information. Now, if you were due commissions, they'll go back and pay you retro whatever you were due. So that does happen every once in a while. Sometimes the agent of record was omitted from the enrollment file. So that is our book of business. Our portal. This is for our broker services. So our broker services, our broker support team, you can contact them at 855-885-3179. Their hours of operation is 7 a.m. through 6 p.m. Mountain Central Time. They're in Salt Lake City, Utah. During open enrollment, of course, those times will be adjusted since we're working more, they're going to be working more as well. So they usually go an hour earlier and then an hour later. Now, those of you that are on the East Coast, like myself, that gives us a couple extra hours. So that'll be 9 a.m. to 8 p.m. on the East Coast. So it does help a little bit there. So once again, broker services, option number 1. So you can email them as well at mpbrokersupport@molinahealthcare.com. They basically handle the general inquiries on the policies or anything you may need. So access to your, let's say, to your accounts. If you're having issues with your broker portal or anything with the member portal, they'll be able to assist you there. Any member information, any of the policy information, you can go ahead and contact our broker services team. So our broker care team is our escalations team. So you can reach them either by calling the phone number or MP Broker Care Team at molinahealthcare.com. This is any access to care, any escalations, any billing discrepancies, terminations, formulary questions. So anything that's an escalation definitely has to go to our care team. Any commissions, our commissions team is our option number 3. So MP Broker Commission Inquiry at molinahealthcare.com. I know it's a long one, but it works. So if there's any broker or book of business reconciliation, any missing member information, that's the team you go to. And then contracting inquiries will be option number 4, MP Broker Contracting at molinahealthcare.com. So any appointment requests, you can also do it through your portal, but you can call in, do any changes to your or updating your agent contact information and your license or E&O. That's the team you contact. So now my counterparts across the U.S. So if you have any questions, if you really want to get into the weeds, have any questions on marketing or where should you target heat, like these, everybody is an expert on their areas. So if you really want to get into the weeds in California or get any additional information, please contact Andrea Espinosa. For Florida and Mississippi as myself, of course, if you want to really get into the certain areas, or if you have questions of certain providers, anything like that, you can, or you're looking for where you should target different demographics, go ahead, let me know. I handle Florida and Mississippi. I'm pretty much all 12 counties in Florida. So Tina Mosley Martinez, she's my counterpart in Florida. So for anyone in Florida, you have two broker managers or marketplace sales managers. So Tina Mosley Martinez handles South Florida. She does Miami-Dade and Broward. So she can also handle any other counties in the state as well, but mainly she's focusing on South Florida. I have the whole state. She does mainly South Florida and South Carolina. Excellent marketplace sales manager. Anything in the weeds, she can definitely help you out. Going over to Idaho and Utah is Adam Grimaldo. He did run Texas in the past and Utah and New Mexico in the past. He's switching over to Idaho now. Been with us for many years, so very knowledgeable, can get into all the areas and anything in Idaho or Utah that you may need. So in Illinois, Michigan, and Ohio is Kasai Tefese. He, once again, KT has been, also known as KT. He's been with us, started on community engagement in Ohio. He's been with Molina the longest out of all of us. I believe he's been with us for about 12, 13 years. Very knowledgeable, can definitely help you out in any of his areas. Newest person on the Eastern team, but not new to Molina. So Jim Mcguire, he is running Kentucky and Wisconsin. He was formerly our Washington representative, our marketplace, our broker channel manager. He went on the Medicare side. So he's managed both Medicare and marketplace for Molina since I want to say 2013, 2012, 2013. He did come over to Eastern team. He's living out of Tennessee now, but he is running our Kentucky and Wisconsin markets. So very knowledgeable, definitely willing to help out those areas as well. Our the newest member to the team overall would be Gene Wedgworth. He is overseeing the Dallas-Fort Worth area in Texas as well as New Mexico. A wealth of knowledge coming over from, he's been in the insurance world for many years. Now South Texas, Gabriel Arguello. He ran the whole state for the last couple of years. He used to run it for one of our competitors for about 12, 15 years prior to that. Extremely knowledgeable, can get into the weeds. He's in the San Antonio area. Wealth of knowledge, like I said, definitely willing to help. And last but not least would be Casey Meehan. He is the manager over our Washington State area. Definitely knowledge individual. He's engaged with the plan there. So there's some expansion going on there. So if you want to get into the weeds, please let me know. I'll get you in touch with Casey. So other than that, I want to thank everybody for this presentation. I don't see too many questions. There are a couple. Let me go ahead and put my contact information up here again, as well as the others. So for let's go ahead and answer some of these questions. So for the ID cards, is every member getting a new ID card sent to them with the new field? So yes, every year we will send out new ID cards. I know this year there was some issue with ID and the USPS, I guess, even sending them out. But yes, everybody will have access to the new ID cards. Everybody will be sent out the new ones, even especially with the new information going on. We want to make sure everything's up to date as possible. Next question. With the plans being closed, will those members automatically go into the new silver plan? So yes, what's happening is the plans will be mapped into a silver plan. The members will be notified prior. But I suggest anyone that you had on a bronze plan, let them know what's happening. For Florida and Mississippi, of course, we do have bronze plans still available. On the other states, those will be mapped into a silver plan. So, and then usually they look at the amount of subsidy and the costs associated. So they want to make sure they put them in the right plan. But yes, they will be mapped automatically into a silver plan. Well, those were the only two questions that I see up there. If there are no other questions, I just want to thank everybody for attending this training today. I know it's a lot of information, so I will be providing Louise with this presentation, a PDF version of this. And then once again, if you need any, if you don't have that readily available and always want to have some information, you can go to molinamarketplace.com. There'll be a section where you can locate all of the plan information. Plus, there'll be another section for just state facts, where you can get all the state facts and quick information for those states. So once again, thank you. I'd like to thank everybody for attending. I want to thank everybody for your business as well. So O'Neill Marketing has been one of our great partners since the beginning. So I appreciate you guys allowing me to come out here and present to you guys. And once again, if you need anything, please, you have my contact information there. Please feel free to reach out. Of course, you got Louise, you got Matt, you got Carrie over there at O'Neill Marketing, wealth of knowledge on all of this. So you can reach out to them first, but if you definitely need something Molina specific, feel free to reach out. Other than that,
Well,
I guess I could throw it back to you, Louise.
yeah, Dennis, I would say that you are the king of the wealth of knowledge. So thank you so much for sharing everything with us today. You covered a lot, but you made it very easy to understand. So thanks a million to you, Dennis, and for all of our attendees. I did want to point out that we're going to have a little lunch break now, and at 1 o'clock, Oscar will be joining us for another webinar. We try to put these in as short period of time as possible, Dennis. So
I get it. I know. I'm just playing.
Anyways, Dennis, thanks so much. Molina, we value your working with you and appreciate your time today.
Well, thank you guys. I appreciate the time as well. Thanks.
All right. Bye-bye.